TV on Channel 8 or on Channel 250 for high definition. And you can also watch us via facebook.com/onenewsph or on YouTube, just enter One News PH. And I would suggest you get the Signal Play app para mapanood nyo kahit saan pa kayo magsuot sa Pilipinas, makukuha ninyo yung agenda. Today is April 19, 2021. It's a Monday and medyo meron kaming konting technical glitch kanina. Actually, pinaparamdaman lang po yung aming acting executive producer. Acting because our regular EP, Gab Malyari, is currently lipat bahay at taking his place is Arvic Tolentino na mukhang sinasampulan ng pagsubok because I actually miss my team. I haven't seen them for a year. I think today was the first time I saw Arvic on cam with while we were talking. Anyway, today we have several guests. First will be Mr. Mark Timbal, spokesperson of the National Disaster Risk Reduction Management Council. And pag-uusapan po natin kasi while many of you may be experiencing sunny, warm weather here in Luzon, be careful because even the international forecasts say that if Typhoon Bising, which is currently in the Visayas, Bicol area, continues on its path, what will happen will be it will go towards Luzon, and you people in northern Luzon will also experience it. Medyo uulanin daw po tayo. So we will speak with Mark Timbal later on in the program because mukhang it seems that the Typhoon Bising has already made its presence felt in the Bicol area, Visayas area. Let's get an update on what's happening there. And then we will also speak with Catanduanes Governor Joseph Cua and find out kamusta na ba ang Catanduanes because I remember last year Catanduanes got hit really bad and marami sa mga kaibigan ko dyan sa Birak na apektuhan din. So let's find out from Governor Joseph Cua. And for the good news naman, we will be interviewing two nurses who have taken up the call, the challenge to leave the province and come into the war zone against COVID-19. They are nurses from two different locations in the province and pumunta sila sa Metro Manila to help out because there is a shortage of health personnel in Metro Manila. But before we do any of that, let's go to our front page of the Philippine Star. The Department of Health reminds private hospitals to accommodate COVID-19 patients as numbers continue to soar. DOH Undersecretary Maria Rosario Vergere says that under the law, private hospitals should be able to expand their capacity 30% of their original capacity for COVID. So kumbaga, dagdagan pa ang mga kama na paglalagyan ng COVID patients. Speaking of numbers, the number of confirmed cases, confirmed COVID-19 cases in the country is nearing 1 million. Malapit na pong umabot sa 1 milyon ang tinamaan ng COVID-19 as it now stands at 936,133. Yesterday, 10,098 new cases were added, bringing the total active cases to 141,089. Meanwhile, the Philippines tallied its highest single-day recoveries with 72,607 COVID-free patients. May gumagaling naman po, kanya lang medyo marami po ang tinatamaan. Okay. And last on the front page of the Philippine Star, the World Health Organization and the World Trade Organization called the sharp disparities of vaccine distribution globally as morally unconscionable. Hindi katanggap-tagap, immoral. According to the World Health Organization, 82% of the 832 million doses of vaccine administered worldwide went to high or upper middle income countries, while only 0.2% have been sent to low-income nations. Ayan naman po that's the reality. What do you expect? Politicians have the moral obligation and the political burden to take care of their own first. Yan naman po. Kanya yung balitang may magtatayo ng vaccine factory somewhere in Bulacan ba yun? O Pampanga in Clark. Medyo welcome news po yan because as it stands, what's happening is you really can't count on those vaccines from abroad because nagkakaubusan po. Kahapon nga, minomonitor ko yung mga pinag-uusapan ng mga world leaders sa balita. And apparently, even in America, they're talking about aabot pa sila ng January, February, March 2022 para mabakunahan pati yung mga anak nila, yung mga bata, yung sa lipunan nila. They're already doing the tests for children. Pfizer is doing the test for children, and actually Pfizer is asking permission, if I'm not mistaken, from the US FDA to use their vaccines or to try their vaccines on children. Kasi nag-test naman sila, nag-clinical trials na sila, so maganda po ang lumalabas na resulta. Pero yun po ang katotohanan. There is a continued shortage of vaccine all over the world, and the politicians and leaders of developed countries, first world countries, will protect, preserve, and prioritize their citizenry. So, anong mangyari sa atin? Nung isang gabi, nadinig ninyo si Presidente, sabi niya, wag kayong umasa kasi marami pang Pilipino ang mamamatay. Wag naman po ganon. Let's not have that kind of defeatist mentality or statement. Yes, it's being transparent. Yes, the president is being honest. But given that, there are other options. Medyo tinatrabaho ko po ito. Hinahanapan natin ng mga resource persons, etc. But I've been checking and someone confirmed, no? Sabi sa akin ng ilan sa mga nakausap ko. Sabi ko, in the absence of vaccines, what can we do? Of course, the government spokespersons will say, well, you have to isolate, you have to social distance, you have to wear masks, limit your movement. That's fine. But there are also other things we can do. Katulad ng magpabakuna for flu, anti-flu vaccine. Okay? Magpabakuna for pneumonia. Okay? Kasi tinanong ko, I'm not going to pretend to know anything about medicine. I asked doctors and the doctors I spoke to, sabi, actually it would help because if you've been vaccinated against flu, then you minimize the chances of having the flu-like symptoms or yung mababawasan. Yung sa pneumonia, ganun din. Because those are the first two things that you experience during COVID. You have flu-like symptoms, it develops, may sipon, may ubo. Ewan ko kung sipon, no? Pero may ubo, maninikip ang dibdib, nagkakaplema, and then ang nangyayari, pneumonia na, nagbi-build up na doon sa baga. Kung nabakunahan ka, baka laang na may tulong at may mangyari. So, that's one option. What are the other options? Sinabi naman natin, palagian ko sinasabi, I've said it time and again here on the program. Let's give Filipinos access to medicines. Kasi kung pinag-uusapan nyo access to hospital, hindi titigil yung access to demand for hospital beds for as long as there are infections, etc. But if they already have access to medicines, nutritional things like zinc, vitamin C, etc., medyo mababawasan po. What I'm suggesting here is let's not raise our hands in surrender. I am not going to kneel and die. I'm going to die fighting if I have to. Kagabilaan nga, sabi ko should I buy a small tank of oxygen? Maybe. You know, people might say, our viewers, Sito, hindi lahat ng tao may kaya. Alam niyo po, yung kaya, kayang bumili ng cellphone, hindi kayang bumili ng oxygen kung ikamamatay mo yung problema mo sa COVID. You know, it's all a matter of priority. We need to prioritize our health, okay? Kasi there are people who don't really, may mga kilala po ako, pinaparinigan ko, narding, yung mga tao ko, nagyoyosi pa rin, okay? Medyo, ang sama na ng sitwasyon, may COVID, nagyoyosi pa rin. Kahapon po, at saka, instead of the president saying many more will die, ano kaya yung higpitan na lang natin yung pag-ikot-ikot at pagkalat-kalat. I'm sorry, but even in the different barangays, kasi kahapon po, I had to buy stuff, I had to get bagong tasa, bagong haircut, buhay pa yung gumupit, magaling. Okay? Kahapon nakita ko po, ang dami nga yung ang face mask, bibig lang ang tinatakpan. Yung iba, nakababa pa nga, nakikipagkuntahan doon sa tambayan ng tricycle, etc. And you kind of wonder, parang, alam ba ng mga taon to, gaano ka-deadly ang COVID-19 variants right now? I mean, the developed countries are all talking about how deadly the UK variant is. They're not even getting into the South African variant na medyo 150 plus na yata dito sa Pilipinas ang na-trace. Sabi nung ating regular si Dr. Ronjin Solante, sabi niya, nako, mabuti kung yan lang. They need to expand the testing. Marami pa sigurado ang merong mga ganyang variants. But here's the thing. The DOH, and with all due respect to Undersecretary Rosario Vergere, the DOH should recalculate or recalibrate or rethink their communication. Because while Yusek Vergere is a calming voice, is a reassuring voice, is a voice who tries to make people not panic, okay? Sometimes, sabi nga nung kaibigan kong si Mayor Alfred Romualdez ng Tacloban, mas gusto ko nang takutin ng tao kasi baka pag natakot, hindi na lalabas. And so, Mayor Alfred Romualdez, he will go out there and he goes, mamamatay kayo dito. Pag tinamaan kayo, mamamatay kayo. Why? Because, when Boris Johnson came out to talk about the UK variant, he said, delikado, it's 70% more contagious, it's deadlier. Yusek Vergere said, well, no, the studies are inconclusive, there's not sufficient data, etc. Kuha ko yun, ang kakalma siya. Ngayon, eto, tinamaan na tayo. Now, we have problems and we're talking about hospital beds, telling the hospitals to expand their capacity. Wala na pong capacity kasi alam nyo, iba yung ICU, iba yung kama. Maglalagay ka nga ng additional beds. Wala ka namang respirator. You don't have the enough oxygen. You don't have enough doctors. You don't have, my friend's daughter, who is a doctor, bravely went to work after getting a close contact notice in the past. Pumapasok pa rin. Nung na-clear na siya, ayun, tinamaan ng COVID. Mabuti na lang. Ang lakas natin kay Lord, nadaan sa dasal at saka nakakuha na siya ng initial dose ng vaccine. Medyo parang tinamaan lang siya ng trangkaso. But we have a shortage. Anyway, punta na po natin. We finally got in touch with Mr. Mark Timbal of the NDRRMC. Mark, good morning.
Sir Cito, good morning po at sa lahat po ng ating mga kababayan. Good morning, sir.
Okay, good morning na lang kasi every time tatawagan kita, mukhang disaster ang pinag-uusapan natin.
Yun
Kalungkot
nga
ano.
po.
Anyway, Mark, what's going on in the Visayas and Bicol region? What's happening with Typhoon Bising?
Yes, sir. So far, with Pag-asa's latest advisory, there's still no certainty whether it's going to have land, it is going to make landfall or not. But we're hoping that the northerly direction will still remain as the direction of the storm. But our preparations for the effect of the storm in central Visayas and the Bicol region had been done as early as Wednesday last week. Our local governments and our regional disaster management councils for Bicol region, Eastern Visayas, Central Visayas, Calabarzon, Mimaropa, Central Luzon, and Region 2, Cagayan Valley, had already done the necessary preparations, the prepositioning of relief items, rescue teams, equipment for clearing operations, as well as the inventory and the preparation for the conduct of preemptive evacuation. In this morning, Sir Cito, we haven't received any report of major untoward incidents that had left casualties dun sa mga kababayan natin. But we received a total of 18,467 families that had been preemptively evacuated in Region 5 and in Region 8. Although we received news, although this is still unverified, that there was one person who went missing in northern Samar during the time of the storm. But our counterparts in the local government and in the Regional Disaster Council for Eastern Visayas are still verifying that information. Part of our preparedness activities, Sir Cito, is that we stopped or we prevented fishermen from going out to sea for fishing activities as early as Thursday in Bicol region. So far wala po tayong missing fishermen ngayon for this time. But because of the suspension of travel, sea travel, we received an advice that we have a total of 2,213 passengers that have been stranded in the different ports in Bicol region, Central Visayas, and Eastern Visayas. Yes, sir.
Okay, now the Typhoon Bising has not made landfall. Hindi pa
That's
yan
correct, sir.
sumasampa sa lupa. Pero ang balita ko kasi, Mark, malakas daw. Is it really in the category of a super typhoon? Kasi alam ko kayo may mga scenario building kayo diyan sa National Disaster Risk
NDRM.
Reduction. Binubuo ko. I need to challenge myself. National Disaster Risk Reduction Management Council. No? I know
That's
you
right.
do disaster profiling, etc. scenario. Ano ba ang basa? Ano ba ang tingin? Aakyat ba, lilihis sa Pilipinas, or will this make landfall based on all the calibrations?
The advice given to us by Pag-asa, sir, so far as of this point, northerly pa rin ang direction ni Typhoon Bising. But this is quite a strong typhoon because some foreign weather agencies are already tagging Bising or Surigay as a super typhoon. But here in the Philippines, based on the qualifications set by Pag-asa, it's still a typhoon category storm. So far po, we're seeing that this is still going on a northerly direction at hindi tatama yung mata ng bagyo sa kalupaan ng Pilipinas. But Yusek Halad, our executive director, had given explicit instructions that the worst case scenario preparations must be done in view of this uncertainty pa rin for Typhoon Bising. So yung ating LGUs, kagaya po sa Cagayan, they're already preparing because this morning we also received notice that the dam management of Magat Dam had also issued an advice na magpapakawala sila ng tubig tomorrow para ma-maintain yung lower level ng tubig dun sa dam. dam. So flood operations are still in progress on the part of our LGUs there.
Magpapakawala sila ng tubig sa Magat Dam pag gumilid na if it continues to its trajectory. Kasi what worries me naman, Mark, is baka mamaya magpakawala sila ng tubig, hindi naman sila ulanan doon, matuyuan na naman yung, yung mga magsasaka dyan sa...
Yung reduction lang po for the purpose of level reduction lang naman yung sa dam, sir. Kumbaga hindi naman nasa dangerous spill level siya for the kaya siya maglalabas ng tubig. Gusto lang ma-maintain yung lower level doon sa dam para in case na umulan nga hindi aabot sa spill yung ating patubig po doon.
Okay, now our first concern is the direct hit of the typhoon, which we are now all praying that it doesn't happen, it continues northward. But what other risks are we more concerned with right now? Because it may not hit land, it may not hit us directly, but the size of Typhoon Bising is such that it is forecasted to generate a lot of rainfall. With rain comes landslide. Meron
That's
na ba
correct,
tayo
sir.
mga area na tinimbrehan na okay, red alert na kayo dyan?
Yes, sir. Actually, in the Cordilleras alone, the Regional Disaster Council for the Cordilleras already made the preparations for possible landslides in the mountainous areas. So nag-preposition na din po tayo ng mga teams natin for road clearing operations as well as the rescue teams. This was also done by our counterparts in Calabar Zone and in the Bicol region because one of the other risks that we are looking at is the possible of lahar flow coming from the Mayon area. At yung storm surge din po, this has also been identified as a possible risk in the eastern seaboard. So local governments have undertaken evacuation of coastal communities then that are at risk for storm surge. Narinig ko kanina yung sinasabi niyo tungkol sa COVID-19, sir. And this is also one of the major considerations in our operations for this type of emergency. That's why last Wednesday, when we issued our advanced guidance to our local governments, this included advanced preparations for evacuation centers to ensure that there will be physical distancing for evacuees, as well as in the process of the evacuees should be wearing their masks. Physical distancing should be observed. The same goes for with the evacuating personnel so that we can make sure na hindi tayo magkakawahan habang nagkakaroon ng evacuation.
What's being done to prepare the country in terms of future evacuations? Because we clearly will be and should be expecting more typhoons,
Yes,
a series of disasters, earthquakes, volcanic eruptions. That's part of life here in the Philippines. But what are we doing in terms of having more evacuation areas or go-to places para hindi talaga magsisiksikan, and because COVID-19, Mark, is going to be here for at least the next 2 to 3 years, if not whenever, medyo parang wala pa kaming nadidinig. And maybe I'm just ignorant, We've not heard of additional locations or evacuation centers being assigned for futures.
Actually, sir, part of the guidance that we gave our local governments back in 2020 was that in view of the possible occurrences of other typhoons, so kasi ngayon, imagine nyo, summer pa lang, binabagyo na tayo. Expect more come this rainy season. The advanced guidance is for local governments to do an inventory of all their facilities na pwedeng gamitin as evacuation centers. This is, of course, aside from the dedicated evacuation centers that the national government has built within the last 2 years. So far, in our last counting, more than 100 facilities that are built as dedicated evacuation centers had been built in various regions. The initial plan is 2 evacuation facilities, major evacuation facility per region. But when the local government saw na very useful yung magkaroon ng ganong provisioning. Lahat ng local governments ngayon ay nag-request na ng pagtatayo ng kanilang mga evacuation centers. And more than 100 evacuation centers had been built following a model design that had been approved by the NDRMC to ensure that the facility is earthquake proof, storm resilient.
Kayo ba, Mark, are you really limited to natural disasters? Because one would think our greatest or worst disaster ever is COVID-19. And I kind of wonder, pati ba kayo nadamay na dito? Have you been tapped or are you actively involved in
Yes, sir.
dealing with this? Kasi ang daming umiiyak, walang mapuntahang hospital, walang paglagyan, etc.
So, with regard to our COVID-19 operations, Sir Cito, since 2020 pa po involved si NDRMC and OCD in the operations. But our primary support is more on the provision of logistical assistance for the transfer of relief support, medical equipment, PPEs to the different locations. And then mid-2020, additional functions were given to the NDRMC in relation to the maintenance of the quarantine facilities and testing facilities. So ngayon po, ang ginagawa namin, aside from supplying these facilities with their equipment, their PPEs, medical supplies, kami rin na nagbabayad ng pagkain for the patients and the staff. Kami rin po yung sumasagot ng hotel accommodations ng mga staff and healthcare professionals na nagmamanage ng facilities. Yung mga hotels din po na tinutuluyan ng mga pasyente natin na under isolation, sagot din po namin yan. As well as yung pagbili ng additional equipment for those facilities, sa amin din po yun at kami rin na nagdi-distribute sa kanila.
Okay, well that's good to know kasi medyo mukhang yun na yung tinutumbok. That's where we're headed, finding facilities and locations for COVID patients because that's the problem. Okay.
Professor Cito, if I may add as well,
Yeah.
last week, to support the testing capability, kasi di ba po puro RT-PCR yung ginagawa natin ngayon, to decongest the RT-PCR lines in the local government units here in NCR+, the Office of Civil Defense under NDRMC purchased 500,000 antigen test kits for the detection of the virus. So we already distributed almost 100,000 units to the different LGUs and hospitals here para kahit nag-aantay sa labas ng facility yung ating mga kababayan, pwede na silang matesting para pagtungtong nila doon, alam na kung dapat silang i-isolate or i-hospitalize.
Okay, well, that's very important. Thank you for sharing that piece of information. Thank you very much, Mark, and we hope that you guys stay safe, stay strong, and stay healthy, and keep us updated regarding this typhoon. Sana it will just be another boring week for you. Thank you very much,
Thank you,
Mark.
sir. Ingat po tayong lahat, sir. Good morning po.
Okay, that's Mark Timbal, spokesperson of the NDRRMC. Puntahan naman po natin si Governor Joseph Cua of Catanduanes. Governor, are you there?
Yeah. Good morning, Cito.
Hey, good morning, Governor. Kamusta na kayo dyan? Anong balita dyan sa Catanduanes? Kayo ba naapektuhan na? Are you affected by Typhoon Bising?
Cito, kasi kahapon pa po malakas ang alon at ulan. Pero nga, dapat ngayon kalmada na, pero tuloy pa rin ang ulan at lakas ng alon dahil na bumagal itong Typhoon Bising na sa ngayon po nasa 40.1 coordinates, nasa tip of Catanduanes po ang location ng Bagyong Bising ngayon.
Okay, and ano ang sitwasyon ngayon? Kasi I remember last year, Governor, tinamaan ng probinsya mo at medyo masakit yung tama ng mga nakaraang bagyo last year. Nakabango na ba kayo or nakakagulo pa rin ito? Makakagulo na naman itong Typhoon Bising na ito?
Yung last year typhoon na malakas, yung Catanduanes, super typhoon din yun, no? Pero tumamak na sa amin.
Oo.
Dito lang isang bagyong Bising ay malayo, no? Baga matasama yung dagat. Pero kami pa rin ang pinakamalapit na lalawigan sa bagyong Bising. Kaya ramdam namin yung lakas ng alon at lakas ng ulan. Pero dapat sa ngayon na oras ito, dapat lampas na sa amin. Kaya lang dumagal yung bagyo at kahit ngayong araw na to, ramdam pa namin yung ulan at lakas ng alon.
Okay, what about yung mga evacuation centers nyo, Governor? Kasi sinasabi nga ng NDRRMC na kung maaari, if it is possible, that we do not overcrowd the disaster, the areas, yung evacuation centers because of fear of COVID-19.
Dito, sa ngayon po, we have 7,519 families, nasa iba-ibang evacuation center. About 29,000 individuals to. Pero palagi kami nare-remind yung i-observe ang social distancing. Sa tingin ko na-observe to kasi hindi lang yung mga evacuation center ang ginagamit natin, yung mga government facilities, hindi yung mga bahay-bahay kasi may kultura namin ito dito, dahil sa Catanduanes, nagkaroon ng kultura kami na ang tawag namin dyan is kirong sa harong. Kumaga, yung mga bahay-bahay na maayos ng katayuan, mas matibay sa bagyo, mga slab na bahay, pinapatuloy din yung mga evacuate natin at pinapatay. Kaya, hindi ito ang mga evacuate natin, hindi tulad sa ibang lugar na talaga nagsisiksikan dahil nga mayroon kaming kultura na pinapatuloy sa mga bahay-bahay dito.
Ayun, that is praiseworthy, kapuri-puri yan, Governor, kasi during this time of COVID, talagang mukhang kailangan, asahan na natin ang isa't isa at hindi puro gobyerno. Matanong ko lang, Governor, kamusta ba ang COVID cases sa probinsya ng Catanduanes?
We have only, I think, 14 or 15 cases of COVID positive. Dahil, of course, isla kami, medyo advantage namin yung sitwasyon na to, dahil isla kami. Pero sa border control kasi, talagang may speak kami. Kung wala talagang COVID negative test, hindi namin pinapatuloy sa Catanduanes.
Okay, very strict ang inyong border control.
Opo, dito. Okay,
well, Governor, maraming salamat sa oras ninyo. And masaya naman ako na hindi naman kayo dinirektang tinatamaan. Sana hindi na tumama sa inyo itong Typhoon Bising. And thank you for your time, Governor Joseph Cua.
Salamat din po.
Okay, yan po si Governor Joseph Cua ng Catanduanes, and many of you might remember last year ginagulpi ang Catanduanes ng Typhoon Rolly at medyo dinaanan din ng iba pang bagyo, so medyo nasaktan ng ekonomiya nila, matagal silang walang kuryente, pero mukhang naka-recover na, and I hope by the power of prayer and by God's mercy, lilihis na itong Typhoon Bising, kasi na maganda naman yung umuulan para dito sa tag-araw, because it will keep everything green, no? And will at least we can plant and we can harvest. Pero mahirap po yung tag-araw, doon ka pa babakbakan ng bagyo, pagkatapos susundan pa ng mga trangkaso, sakit. Ay, nako po. Okay, let's go for a quick break. We'll be right back here on Agenda. Okay, welcome back to the program agenda. I'm your host, Cito Beltran, and you are watching us via Signal TV through the assistance of PLDT Home Fiber. And yun po, no, kung hindi pa kayo nakakapagpakabit ng signal at nanonood kayo sa Facebook, magpakabit na kayo, gamitin nyo yung PLDT Home Fiber. Kasi po, pwede nyong i-couple. Pagsabay, package deal. Makakamura na kayo, tapos wala pang laglag, wala pang laylayan. Kasi medyo iba ho talaga pag kailangan nyo. It's really different when you package Signal TV with PLDT Home Fiber. That's what I use here in Lipa City. That's what I use in Capitolio, in Pasig. And we are very happy with it. Okay. And klaklaruin ko lang hindi po tayo paid endorser. Ako kasi ganun na ugali ko. Sa pagkain ng baboy, bimig. Sa gasolina, petrol. Sa internet, PLDT. Yan yun. Okay. Anyway, let's go. Alam niyo po, honestly speaking, I've been wanting to go back to Manila, medyo, di ba, may MECQ, so bawal maggagalaw-galaw kahit naapor ako. Pero kasi nakaka-nervous pumunta ng Metro Manila ngayon. Kumbaga, the red zone, sabi nga nila, no? Pero may mga taong bayani talaga. For ever since COVID-19 started, our health workers, our frontliners have been called heroes. And it is an even bigger act of heroism. Yung okay ka na sa probinsya, presko, clean air, etc. Very little tension and stress in the workplace. Biglang lilipat ka sa Metro Manila para lang makatulong, naku po, kabayanihan na yun. Pero, kilalanin muna natin. Let's find out our next guest. Let's welcome to the program our brave nurses from Mindanao who will be reassigned in Metro Pacific hospitals in the National Capital Region. First, Elviro Firmalino, 39 years old, infection control nurse at St. Elizabeth Hospital since 2017. Before working at St. Elizabeth, he worked with an NGO as a medical support staff, also worked as med rep at another hospital sa Jensan. Mukhang ito yung na nga ba ito, Elviro, mukhang tiga Mindanao. The other one is Raven Saavedra. Parang Mindanao Raven Saavedra is a registered nurse employed by the West Metro Medical Center in Zamboanga City. 22 years old, palaban, began his nursing career at the hospital in August 2019, after he passed the nursing licensure exam. He was originally assigned to the medical surgical unit, but when the coronavirus pandemic hit the country last year, he alternated duties at the hospital's COVID-19 unit respiratory wing. Okay, Raven at saka Elviro, welcome to the program.
Welcome po, sir. Hello po, good morning.
Okay, good morning guys. Okay, yung nakaputi, ikaw ba si Elviro?
Raven po, sir.
Si Raven. Yung naka-itim, yung Elviro. Okay. So, welcome to the program, guys. And please allow me to express my gratitude as a citizen. And syempre, na masabi ko na rin bilib ako sa inyo. Kasi masarap ang buhay sa Zamboanga Masarap ang buhay sa Jensan. Bakit ang tatapang naman yung sumugod dito, Raven? What made you decide to come to Metro Manila?
Actually po, sir, lahat po naman tayo may doubt kasi alam nyo na po, tumataas po yung cases dito and all. And for me po kasi parang gusto ko lang po mag-take part and I would like to extend my a helping hand to the people here in Manila. Kasi yun na nga po nakikita natin sa mga news, tumataas na po talaga yung cases dito. And I just want to and me and my colleagues would like to be a part of history also and help people here in Manila.
Okay, Raven, sa grupo mo, ilan ba Ilan ba kayong pumunta sa Metro Manila?
Apat po kami actually dito ngayon,
Okay,
including
apat. Okay. What about you, Junex? Oops, Junex. Ikaw naman, Junex, galing ka pa ng Jensan ba ito?
Yes po, sir. Galing pa po ako ng Johnson.
Okay.
Bali, 8 po kami dito from Johnson po. So, lahat po kami from St. Elizabeth Hospital.
Mhm.
Dumating kami nung last Monday. And then, yung pagpo-volunteer kasi namin, sir, is hindi na po ito bago sa amin. So, since last year po, nung kasagsagan din po ng COVID po, so andito din po kami last year po, nag-volunteer din po kami to help po the NCR hospital po. So last year we were assigned at the Our Lady of Lourdes po hospital. And then for this year po, we were called once again. Tinatanong po kung gusto ba namin ulit tumulong dito sa NCR. So eto na po ngayon, andito na po kami ngayon kasi nga po alam po namin kasi inaabangan po namin kasi yung daily po na na cases po. So medyo tumataas kasi yung case and uncontrollable po. So kawawa naman din po kasi yung mga colleagues po namin kung pababayaan po namin at the same time yung mga yung mga tao po sa community po.
Okay, you mentioned you were here last year. How different was last year to this year based on sa nakita mo sa emergency, sa ICU, etc. I'm sure may point of comparison ka. Anong kaibahan? What's the difference from last year to this year?
From last year, sir, sa ngayon po kasi, sir, medyo uncontrollable po kasi ngayon po natin. So, andun po yung biglang pagtaas po ng cases to compare po last year. Last year po kasi medyo nakokontrol po natin yung last year po kaysa ngayon po. Although last year so tumaas po konti yung yung mga cases po. But today po parang nagwala po ata yung COVID cases po ngayon to compare po sa last year po.
Okay, but what is it like in the emergency room in the ICU? Kasi last year nadadali pati yung mga nurse, pati yung mga doktor. Is there still that sense of apprehension, fear, or feeling ba ninyo na nagdaan na kami dito, kayang-kaya natin to?
Okay po. Sa ngayon po kasi, what makes different is that we have the new variant of the virus po. So, but up to then, yung mga cases po natin or pag-handle po ng mga cases is that kailangan po kasi natin maging resilient po at the same time. Kailangan natin maging flexible in handling cases. Although ando na po yung surge, but then in caring and treating patients po, same pa rin po. What makes difference po that is that kailangan po natin mag-ingat. Kailangan kasi nga sa ngayon lang kasi yung pag-treat po natin ng patient is that may suot-suot po tayong PPE. So para po tayong mga astronaut. So at the same time, in normal cases kasi pag wala yung surge po or yung COVID po, we treat the patient according kung ano yung sakit niya. But since pandemic ko ngayon, may extra protection po yung na sinusuot yung healthcare worker po. So that is yung mga PPE natin. So sa ngayon, sir, dobleng ingat po kami at the same time. Although andun na po yung pagod sa pag-handle po ng cases, pero kailangan po talagang lumaban po at tumayo po para po matulungan yung mga pasyente.
Okay, Raven, were you here last year as well? Raven? Mukhang naghahang si Raven. We will go for a quick break. When we return, let's continue our interview with our volunteer doctors from Mindanao who are lending a hand here in Metro Manila in the NCR. We'll be right back here on Agenda. Okay, you're back here on Agenda. I'm your host, Cito Beltran. And for those of you who may not have heard about these volunteer nurses coming to Metro Manila, actually, it's a program or an action initiated by Augusto Palisok Jr., Director, President, and CEO of the Metro Pacific Hospitals, part of the MVP Group. Okay? And ang ginawa po ni ni Director Palisok was that he called upon all of the hospital members of the Metro Pacific Hospitals Group all over the country and asked, are there any of you who can help in NCR in Metro Manila, because we are overrun, we are swamped, and Metro Manila needs nurses, etc. So what happened was the how do you call this? Directors of 3 hospitals in Mindanao, West Metro Medical Center, Zamboanga City, tapos Manuel J. Santos Hospital, Butuan, Agusan del Norte, and St. Elizabeth Hospital General Santos City, all stepped up and sent a team to Metro Manila to help. Okay, so let's go back to our guest, Raven. Ikaw ba nandito ka rin last year or is this your first time?
First time po namin to volunteer in Manila, sir.
Okay, and na-shock ka ba nung nakita mo yung gaano kalala yung COVID situation here in Metro Manila?
So far po kasi, sir, di pa po kasi kami nag-start mag-duty. Pero yun na po sabi, like, nakikita po namin sa news na marami na pong cases. But I think we are ready naman po to extend our help.
Mm-hmm. Do you have similar? Do you have experience with COVID crisis in Zamboanga City? Kasi hindi namin masyadong napipick up. Kasalanan ko rin yun. Hindi kami masyado nakaka-reach sa Zamboanga. Nabibisi dito sa Metro Manila. Pero kamusta ba sa Zamboanga yung COVID cases and how are you coping sa Zamboanga?
Especially last year po nung kasagsagan po ng COVID, dumadami din po talaga yung cases doon sa Zamboanga. But of course, we nurses are always ready naman din po, and naagapan naman din po namin yung mga cases doon and help naman yung mga tao. Pero ngayon po, nakita ko rin po sa news, mas dumadami na rin po yung cases doon sa Zamboanga. Pero I know naman din po yung mga nurses doon is ready na din po to fight this rising cases there in Zamboanga.
Oh, okay. Now, Junex, ano ba ang timetable ninyo? Are you guys going to be here for 3 months, 6 months, 1 year? Ano ba yung enlistment period ninyo? Kumbaga sa gera, nag-enlist kayo for gaano katagal yung term of duty ninyo?
Alright. So yung we were said, sir, that we will be here for the next 6 weeks po. So, yun lang po muna yung sinabi sa amin. And after that, hindi na po namin alam if ever po i-continue kami or discontinue na po. But as far po sa information po na sinabi po sa amin is only 6 weeks po.
Meron pa bang mga nakaabang or second batch or third batch na naghihintay sa Zamboanga, Raven or Junex, Jensan? Meron pa kayong mga tropa doon na Sige, mauna kayo and kami, susunod kami sa next wave. Raven.
Doon po sa mga colleagues ko from Zamboanga, West Metro Medical Center, marami naman din po gusto mag-extend ng help. Pero as far as ngayon po, kami pa lang po yung first batch from Zamboanga City.
Mhm. Okay, and what about your families? Junex, I'm sure may mga pamilya kayo, hindi ba sila concerned, natakot ba sila na pupunta kayo sa Metro Manila?
Yun nga po sir, first and foremost sir, yung concern po talaga nila is that alam kasi nila na madami yung cases dito. And then nung una pa lang sir, nag-express na po sila ng worry nila and sobrang anxious na po na pupunta kami dito ulit. Ang sabi lang po namin sa amin sir is that kung pwede daw hindi na kami sumama dito sa sa Manila po para mag-volunteer. But then nagpursige po kami talaga na kailangan namin pumunta dito despite the fact po na ayaw po talaga nila na magpunta dito. Kasi nga, nag-aalala din sila po dahil nga sa cases, so baka din kami po mamaya ay mahawa na rin po kami sa COVID.
Okay, well, gentlemen, thank you very much for your volunteerism, for your courage, and for your services. And may the Lord, may God Almighty protect you, keep you COVID-free, and return you to your families healthy, strong. And thank you for your time today, gentlemen.
Thank you po, sir. Thank you po.
Okay, yan po si Raven and si Junex. They are part of the Metro Pacific Hospital groups, particularly in Gensan and Zamboanga. I hope I got the Gensang location correct. But in any case, yan po, no? Makikita ninyo na hindi nagkukulang. And speaking of heroism, please text, call any doctor, nurse na kaibigan ninyo, frontliner, or police, o kaya ay mga health workers. Text them, call them, and just tell them, I appreciate your work. I appreciate your doing your duty for the country and for the people. Kasi isang magandang storya, si Dr. Hani Banyo, anak ni retired General Boy Banyo, alam niyo po, nag-duty na siya for quite some time, and at one point medyo nadaplisan na siya ng COVID. Nagpanic na yung tatay niya, and then lately tinamaan na naman ng COVID. So medyo maswerte na lang na recovered na siya. But they don't think twice about it. They keep going back to battle. And let's appreciate them. I'm Cito Beltran, thanking you, appreciating your company this morning. May God bless you, and please take care.